This is Dr. Poornima Mathur,
Go ahead.
fertility. Good afternoon, everyone. This is Dr. Poornima Mathur, and today we are going to talk about ovarian reserve tests. So we've all heard about it. AMS शायद सबने सुना होगा. So we want to know कि what are these ovarian reserve tests? What are the different options of the different tests that are available? And do I actually need it? Or if in case I need it, when should I get them done? So this is natural fertility. Now, if you would be knowing this, let me tell you कि हमारी जो fertility rate है that gradually declines with age. Now, the blue line represents the men and the pink one the females. So, men में the fertility is not majorly affected with age. So, after the age of 45, there is a slight decline in the fertility. But in women, the fertility starts declining once you are in your 30s, more so once you've crossed 35. So can we measure our fertility? Can we assess कि हमारी fertility potential कितना है? And when do we get that assessment done? So that is हमारा ovarian reserve test because it's your ovaries which are majorly responsible for your fertility. So we all know we've heard about the biological clock, the reproductive aging. So let me tell you a little bit about reproductive aging. So fertility is reduced with the increasing age of women. क्यों? Because we know that we are born, हमारी जो ovaries होती हैं, they have the follicles, the eggs which are going to make the baby. So the ovaries are born with a set number of follicles. So when you are born, you have a decided pool of follicles which are going to be used up in your subsequent menstrual cycles in order to give you a pregnancy. Now with advancing age, with every cycle, जब आपका एक egg बनता है, उस एक egg के साथ साथ there are certain follicles, certain number of follicles जिनका attrition होता है, apoptosis होती है. This is the follicular attrition. So with age, आपका जो ये eggs का pool है, that constantly decreases. And this decrease in the primordial follicles or the follicular pool जो है हमारा, that is responsible for the reduced fertility in case of women. So ये जो decline in your fertility है, that is seen evident throughout, but more so once you've crossed the age of 35. So it has its peak at around 37 years of age, जब आपकी fertility एक steadily decline होता है. अगर हम एक सिंपल टर्म्स में बात करना हो तो women in their early 20s उनके जो चांसेस हैं ऑफ नॉट कंसीविंग अगर कि मुझे 1 ईयर में प्रेगनेंसी नहीं होंगी that would be less than 5% if I'm in my early 20s. But when the age group increases to 35 years or above, the chances of not conceiving in a year of actively trying would increase to over 30%. So, what are ovarian reserve tests and why are they used? So, ovarian reserve tests are basically ये decide करने के लिए कि आपके number and quality of follicles क्या है in the ovary at a particular time. Now, your ovarian reserve test की value would be different today as compared to what it was 5 years earlier or 5 years later. This will give you an idea about आपकी life, आपकी ovaries में at this point of time, what is the number and quality of follicles. So what are the different test done? तो आपकी जो ovaries के reserves हैं, they can be assessed with the help of ultrasound, जो radiological investigation है, जिसको sonography भी कहते हैं, और blood test, जिसमें आपके blood levels, hormones के analyze किए जाते हैं, and certain dynamic tests which are not done routinely now. So what are the ultrasound ovarian reserve tests? उसमें हम क्या क्या assess करते हैं? So the basic ultrasound जो एक gynec examination में होते हैं, that is a transvaginal ultrasound, that is used to assess आपका uterus and your ovaries. तो जब आपकी ovaries assess होती हैं, आपकी ovarian volume, antral follicle count and ovarian stromal vascularity, ये चीजें हैं जो हमें help करती हैं in predicting what is your ovarian reserve test. So in maybe the most common one आपने antral follicle count और AFC के बारे में सुना होगा. So अगर मैं briefly बताऊं आपको the ovarian volume जो है आपकी जो that gives an idea about आपकी ovaries में कितने follicles हैं. This would reduce with advancing age. अगर आपकी volume बहुत ही low है that is हमारी menopausal ovaries की तरफ जा रही है आपके अंदर follicles के chances होने के कम हो जाते हैं. The antral follicle count gives a measurement of कितने आपके antral follicles हैं in the ovary. And the stromal vascularity से हमें पता चलता है how is the blood flow to the ovaries. So the antral follicle count which is more routinely used वो यूजुअली किया जाता है विद द हेल्प ऑफ एन ट्रांसवेजाइनल अल्ट्रासाउंड, द अल्ट्रासाउंड मशीन। बेस्ट डन हमारे साइकिल के आपको जब पीरियड्स आते हैं उसके सेकेंड और थर्ड डे पे, वेयर द एएफसी इज मेजर्ड। सो अगर आप ये इमेज देख सकते हो तो इसमें दिस इज द इमेज ऑफ ओवरीज, द राइट ओवरी एंड द लेफ्ट ओवरी। ये जो छोटे छोटे आपको डार्क डार्क से सर्कल्स दिख रहे हैं, दीज आर द फॉलिकल्स, यूजुअली इन द रेंज ऑफ 2 to 9 mm की जो साइज होते हैं, दे आर द इंट्रल फॉलिकल्स। नाउ व्हाई आर दे इंपॉर्टेंट? बिकॉज अगर हम आपको कोई मेडिसिन देते हैं फॉर फर्टिलिटी और यू अंडरगोइंग आईवीएफ स्टिमुलेशन, these are the follicles which are going to respond to the hormones. So आपके ओवेरियन रिजर्व टेस्ट से हमें आइडिया लगता है कि हाउ आर यू गोइंग टू रिस्पॉन्ड to an IVF treatment if you are undergoing an IVF treatment or any ovulation induction that you are undergoing. So ये जो follicles हैं जो आप देख सकते हो छोटे छोटे डार्क between the size of 2 to 9 mm, these are counted in both the ovaries on preferably second or third day of your periods. Now this is known as the angel follicle count. The normal range would be more than 10, around 10 to 18, adding when we add up from both the ovaries. If it is less than 5, it is called a poor ovarian reserve or low AFC count. Now the ovarian stromal vascularity. Now आपकी ovaries को कैसे blood flow मिल रहा है, वहां से दैट वैस्कुलर सप्लाई से हमारे जो एंडोक्राइन और पैराक्राइन सिग्नल्स हैं वो फॉलिकल की ग्रोथ को रेगुलेट करते हैं। सो अगर आपकी ओवरीज की वैस्कुलैरिटी काउंट की जाती है, देखी जाती है, नाउ दिस इज टू मच इनटू टेक्निकल डिटेल, कि अगर हमारा आरआई मोर देन 0.56 है तो हमें पता है कि ओवरीज को शायद रिस्पॉन्ड करने में टाइम लगेगा और इनका रिजर्व इज कॉम्प्रोमाइज्ड, they might take more dosage or more stimulation for the ovaries to make eggs or follicles. Now, the most talked about AMH. Let's talk about it in details. तो AMH also known as anti-Mullerian hormone. Now इसके बारे में हमने बहुत बार सुना होगा. How many times you must have seen कि हम routine test के लिए गए, we are pretty young, हम fertility उसके लिए जाते हैं and suddenly we are told कि हमारा low ovarian reserve है, आपका AMH बहुत low है, आपका AMH high है. What is this AMH and how does this affect आपका fertility potential? So AMH जो है, that's a hormone which is secreted by your primordial follicles. इसका सीक्रेशन जो है आपकी साइकिल की लेंथ से पे डिपेंड नहीं करता. सो अनलाइक AFC which is assessed on second or third day of periods, और certain hormones जो हम FSH और LH और inhibin और E2 करते हैं calculate on the second day of periods, this can be done on any day of your cycle and it has a very good correlation with your antral follicle count. So this AMH value जो है वो हमारे सारे हमें एक आइडिया देता है कि हमारी ओवरी में कितने एग्स हैं. अगर टू बी वेरी फ्रैंक एंड वेरी प्रैक्टिकल अगर हम देखें तो अगर हमें जानना है कि हमारी ओवरी में कितने फॉलिकल्स हैं, वील हैव टू काउंट ईच वन ऑफ देम, व्हिच इज प्रैक्टिकली इम्पॉसिबल. So we take it as the hormones which are secreted by these follicles which will help us know what is the ovarian reserve. So now this AMH जो है अगर हम देखें तो नॉर्मल हमारी AMH की रेंज वेरी करती है एज पर एज ऑल्सो. Now at the age of 25 अगर मेरे लिए AMH value of 3 normal है, at the age of 40 an AMH value of 1 would be normal for me. So the AMH declines with age because we know the number of eggs is also steadily declining with the age and hence is our fertility. So AMH levels को interpret कैसे करते हैं? Now if you get your AMH levels done, अगर women under the age of 35 है, so on normal हम देखेंगे 1.5 to 4 जो AMH है that is considered to be normal. If it is less than 1, that is where we are worried कि it is low. And less than 0.5 would be very low जब हमें पता है कि okay, the stimulation might be difficult, आपके eggs बनना difficult होगा, number of eggs and quality would be less. So that is about AMH. The other hormones that can be measured along with AMH is हमारे basal FSH level, estradiol level, LH levels and inhibin B levels. Now FSH जो है that is a hormone which is secreted by the pituitary. इसका assessment is usually done on second day of periods. इनके जो levels होते हैं they tell us how responsive our ovaries are. Now अगर values more than, now what is the significance? अगर मैं ये सब hormone test कराती हूँ, is it going to help me apart from telling me कि अच्छा आपकी fertility low है, मुझे AMH ने भी बता दी है. What is the importance of getting it done? सो इसका ये है कि इफ इन केस यू आर अंडरगोइंग अ फर्टिलिटी ट्रीटमेंट, सो इसकी वैल्यूज विल हेल्प प्रिडिक्ट आपका रिस्पॉन्स कैसे होगा. इट विल हेल्प अस इंडिविजुअलाइज योर ट्रीटमेंट कि ओके वी नो कि ओके योर AMH इज लो, योर FSH is high, so we can make a protocol as per your anticipated or expected response. Similarly, we have serum estradiol levels. Now, अगर अकेले हम serum estradiol levels देखेंगे, that usually has very little value. But when combined with the basal FSH level, it is very informative on predicting how the ovaries are going to respond to the medicines, injections, or tablets. Now, inhibin B, it is not very widely used these days, but if the levels are more than 45, it does predict a poor response. सो हमने इतना सारा बात किया कि ओवेरियन रिजर्व के टेस्ट हमारे ये हैं. वी आर नॉट कवरिंग द डायनामिक टेस्टिंग, द क्लोमिफेन चैलेंज टेस्ट, because they are not routinely done. The most commonly done are the AFC and the AMH. So now we know what are the factors that affect the ovarian reserve. ये हमारे ovarian reserve क्यों vary करते हैं person to person. So what are the factors? The most important one is, first is your genetics. Like you are born with a set number of eggs. If the start pool जो है आपका of eggs is low, you will have a lower AMH at your age as compared to a counterpart जिनकी number of eggs to initially begin with is higher. The other most important factor is the age. We know age affects fertility. Beyond the age of 35 हमारी fertility steadily decline करती है. The ovarian reserve is a marker of your fertility. Now, the age would affect your ovarian reserve. Now, somebody who's at the age of 40 years would have a lower reserve as compared to somebody who's at the age of 25. Now, the other factors, apart from the genetics that you're born with a set number of eggs, or आपकी जो genetics है which you cannot alter, age is also something that we cannot control. Are there other environmental factors जो हमारे ovarian reserve को affect करती हैं? Is there something that can change my decline in fertility? So one is BMI. If you are obese to morbid obesity, that can significantly affect your quality and number of eggs. Smoking, there has been n number of studies. Initially, these studies were like, okay, let's, since smoking is harmful, so there is indirect evidence that it affects the ovarian reserve. But बहुत international studies हुई हैं which have proven that smoking does affect आपकी number of eggs, the quality of eggs that you have, उनका genetic composition, and your fertility and chances of conception. Similarly, alcohol also has a very negative effect on your ovarian reserve. So if you are into smoking or drinking, that can lead to a significant decline in your ovarian reserve and your fertility. Agar if you are into too intense exercises, now here we are not saying moderate workout. So when you are into intense heavy exercises, uski wajah se bhi your ovarian reserve can be affected. Now the other important thing is अगर आपकी ovarian surgery हुई है, जैसे अगर endometriosis के लिए हुई है, कोई cyst है, any pelvic radiation that is happening, so that affects आपके ovarian tissue को, and hence आपका ovarian reserve कम हो सकता है. So if I have to show you the various parameters that are there, age के हिसाब से अगर हम करें तो your AFC is steadily declining from 13 to around 4 at the age of 41. Your AMH is declining and your FSH increases. जब हमारा FSH increase होता है means your ovaries are not responding. That is a predictor of poor response of your ovaries to the ovulogens or in medicines or injections. So these are the things how they vary with age. So now that we know, okay, these are the ovarian reserve tests. Now, when do I get tested for the ovarian reserve? Now, is it like if only if I have a fertility issue, should I go and get my ovarian reserve test, or क्या मैं routinely भी करवा सकती हूँ? Now, one is if you know that you are planning your career. You are not planning your pregnancy anytime sooner. Say, for instance, you're not going to plan a baby till 35 because you are busy in your career, you're working, you have other priorities set in. So if you're planning to delay your fertility, it is always better कि आप अपना एक बार ovarian reserve check करा लो. If it is on the lower side, you know that we have to get a fertility preservation done so that later on when you plan to start your pregnancies, there are no hurdles and you do not regret focusing on your career. I think every girl around should have the liberty to have both the things, the career and the family pleasures without any regrets. So if in case due to any reason we are planning to delay our marriage, our pregnancy, we can get our ovarian reserve test done so that we can plan it accordingly. If in case it is low reserve and we can go ahead with the family planning, we can start with the fertility. Or if in case we want to delay the pregnancy, we can go for fertility preservation. If you are more than 35 years and you've not yet started your family, and that is where you can get your ovarian reserve test done so that your further line of management can be decided accordingly. It is also routinely done if in case you are undergoing an endometriosis surgery or any surgery on your ovary where you know there is a likelihood of decrease in reserves. So before the ovarian surgery, mostly done for endometriosis, जो है, we prefer getting an ovarian reserve test like AMH. After the surgery, the AMH is repeated again so that we can assess what was the loss of the ovarian tissue, and appropriate guidance can be given to the particular lady in question regarding what should be her further course of action. Now, if you have a history of premature ovarian insufficiency in family, now how do we even know that? When you sit with your mothers, your aunts in their family, that is your maternal aunts, masi and all, and if you ever have a discussion, ki, okay, if some they say ki, okay, हमारे periods तो हैं before the age of 40 बंद हो गए थे when you were this young, so that is where you know कि, okay, there is, if they had stopped having their periods before the age of 40, that means कि हमारे family में premature ovarian insufficiency हो सकती है. You ask your sister, elder sister, if in case of your mother or your maternal aunt. Now, if there is a history of premature ovarian insufficiency, that is where you get your ovarian reserve test done so that you can take adequate steps at the right time, whether for planning your pregnancy or for planning your fertility preservation. Okay, so now all said and done, we are already towards the lower AMH. Can we actually improve it? So when we are talking about the ovarian reserve, now instead of AMH, we can take it as the entire ovarian reserve that we're talking about, the quality and the quantity of the eggs. Can there be any improvement in it if we want? So everybody says it, but it still holds true. There's nothing better than a diet and the lifestyle changes. So if you are on a healthy diet where you have your antioxidants, your greens, fruits, which are rich sources of vitamins, better consult a nutritionist and then go for a diet. That is how you can improve your fertility. Now, the AMH is not suddenly, the ovarian reserve tests are not going to show a major improvement suddenly. We do not expect it to rise as well because the number of pools, we are not making any new eggs in the body. But we can work towards improving the quality of the eggs or the oocytes. So getting on a healthy diet. Now here I would like to emphasize that when we are talking about a healthy diet, it does not mean कि हम social media पे देखेंगे somebody saying let's go for keto, somebody saying I have to drink this juice only, somebody saying I'll go for intermittent fasting. It's always advisable that you please consult a nutritionist or a dietitian who can actually make out a plan for you which does not compromise on your nutrition, is appropriate for your needs, and is more sustainable. So, making dietary changes, having an active lifestyle, including workout for at least 30 minutes at one time, either in the morning or the evening, and practicing de-stressing yourself, practicing yoga or meditation, that has significant impact on your fertility. Smoking and alcohol cessation, that is very important. Now here we do not expect somebody walks in drinking has smoking 8 to 10 cigarettes per day and we say okay fine, stop at this very instant. That's practically not possible. So it is, please take the help of a doctor, get into de-addiction, try to reduce the number of cigarettes that you take, supplement it yourself with antioxidants so that it can be taken care of. If in case there is any family history of premature ovarian insufficiency, a genetic analysis for the Fragile X mutation would help so that the further course of your pregnancy, the genetic evaluation can be done. There are certain adjuvants that are given, certain DHEAs and other hormones that are given by the fertility doctors to improve the fertility, improve the quality of the eggs, and the ovarian response to the stimulation and injections. They are commonly used. The latest thing that is being used at our centers is the ovarian PRP and ovarian stem cells. Now, PRP, that is the platelet-rich plasma, has been routinely used because in various parts of our body, in like various, the dermat people are using it, the ortho people are using it. So many doctors are using it throughout because it has a very good growth potential. So the PRP, when done in the ovary, there are many international studies which have shown to have improved the number of good quality eggs, that we say the M2 oocytes. The number of egg has increased, the AMH has improved, and the fertility has improved. Similarly, the stem cells has also shown a that is still under the very less commonly used, but still showing very very promising results. Apart from this, there are other methodologies that are being done to improve the fertility, like acupuncture, cupping, etc., and herbal medicines. So all these can help us improve our fertility. So all those women out there, if please, I would say our health comes first. It is you love yourself before you love anybody else. Please focus on your health. The ovarian reserve test is not only for fertility, it can also help you plan your the streamline of your life, like where do you want to go, when do you want to start your family, and how do you intend to do it with minimal hurdles. Thank you so much. Any questions? Um, what are the tests? We've just covered the tests of ovarian reserve. They can be done, they can be the blood test or an ultrasound examination. In the form of the ultrasound examination can be the intral follicle count, ovarian volume, the blood flow, or the blood tests like the AMH, FSH, LH, and estradiol levels and inhibin. So if you want to check your egg reserve, it's like I would suggest you visit a gynecologist. They would do an ultrasound examination and then complement it with the help of a few blood tests so that you can actually check your egg reserve. So I would say for a normal age range for ovarian reserve testing, so the range would actually vary per every test. Now the age, when do you get your test? You should have your test at the age of 35. Now the AMH would have a different range for your age. The AFC would have a different range for your test. So it would depend upon what test are we talking about. So there are different. The most commonly used blood test to show egg reserve is the AMH level. That is most widely used. That is correlates well with the ultrasound markers as well. So that is the most commonly used blood test to show your egg reserve. Apart from that, we have the FSH and estradiol levels and the inhibin. Thank you so much. So, if in case you have any queries regarding the ovarian reserve testing, what are the different tests, how can you avail them, whether or not you need them, or if you've been diagnosed with a low reserve and you need to intervention, please feel free to contact us at Oasis Fertility. We are here at Oasis Fertility. We have all the facilities available for ovarian PRP, ovarian stem cells, and different newest technologies to help you out with your journey. Thank you so much.